Healthcare Administration by Sharon Trimpe, National American University. Disease management in the United States. There is a complexity to managing cases within the United States. Disease management, DM programs to benefit members with diabetes and hypertension. Value programs are coordinated by skilled, compassionate registered nurses who personalize and tailor services to benefit everyone. Promoting quality of life and their approach to healthcare teaches people how to manage chronic illnesses so complications are minimized and quality of life is promoted. A strong emphasis is in place to offer education, which is the key role in reinforcing their knowledge of the medications, diets, physical activity, and know the warning signs. Members are enrolled through medical associated health plans and they have no cost to participate. In Canada, disease management, Canadian healthcare is changing and views the burden of effective management of chronic diseases, while good health increased, the occurrences for chronic diseases rose. Chronic diseases are common more for the age-related and burdensome in Canada. Overall, they perceive themselves as being healthier than any other country. Implementations of coordinated care of disease management programs were set to improve the care of patients with chronic illnesses. Further insights are needed, particularly in variable perceptions of the values of efficiency of team-delivered healthcare and its important components. New Zealand. Chronic diseases are accounted for 92% of all deaths and disabilities. Maternal and perinatal nutritional deficiencies, diabetes, chronic respiratory disease, cardiovascular disease, providing healthcare systems to monitor the delivery of care and find help for the individuals that are suffering from chronic diseases. More complex cases. Diabetes, 2 or more other chronic diseases, have an AC1 greater than 9%, have or had 1 or more admissions to the hospital during the past year. An average length of time for the complex case management program is usually 6 months to 1 year, and although some can last up to 2 years, depending upon the needs of the individual member. Delivery of healthcare within the United States. Healthcare sector in the United States consists of an array of clinicians, hospitals, and other healthcare facilities, insurance plans, and purchases of healthcare services, all who operate in various configurations of groups, networks, and independent practices. Generally referred to as the healthcare delivery system, and it does not generally interact effectively with other components of the public health system. Some may be public, while others are more private. Access is through insurance and is through a publicly financed program or a private plan. They have regulators, and some are voluntary, while others are governmental. Publicly funded insurance is provided primarily through 7 government programs like Medicare, Medicaid, and others are supported through health centers, and is mostly directed towards the elderly, disabled, and low-income population. Canada's delivery of care have different roles of other government and other departments that provide the care they receive. It is publicly funded but privately delivered by private physicians, and the provinces are primarily responsible for the administration and delivery of healthcare service under the Constitution Act 1867. In the funding, provincial and territory healthcare services and only deliver healthcare to specific groups and provide and fund other health-related functions House of Commons. The delivery of healthcare refers to the way services are organized, managed, and provided. It is only delivered through private providers. Funding is more 3 primary sources: public, private, and out-of-pocket. Patient participation within the U.S. Patients have access through their electronic health records. They can receive accurate information and able to communicate through EHRs to their physicians. Providers can follow up with patients after office visits, as well as email them with responses to any questions the patients have. It has the capability to position providers to be more proactive by reaching out to their patients. Providers can provide other information to their patients through patient portals that are tied to their EHRs. Patient participation in Canada have different programs for patients to interact with their physicians. Medicode, RIAS are used to communicate between the physician and the patient. Information based on the recall of the patient visit, and they responded by using a recording device like audio tapes or CDs. A 3 comparison chart. As you can see, New Zealand had a higher for chronic diseases, while the US comes in a close second. Canada has less. When it comes to the low income, as far as like comparing like the delivery of care and healthcare, United States is 3.5, low income is 1. Canada is 1.8, New Zealand is only at a 3. As you can see with the age, Canada is in the lead with a 4.4, while the US is with a 2.5 and New Zealand is 2. Diabetes cases in healthcare related to New Zealand is a 2, Canada a 2.4, and the US a 4.3. In conclusion, knowing the way healthcare is delivered in different countries, one can see the diversity in how it is funded as well as changing. In the chart of New Zealand, US, and Canada, it is evolving more than what you see in New Zealand. However, nonetheless, it is important to know and understand how the government plays in healthcare and how state and federal funded organizations are able to provide the financial to keep programs going like Medicaid and Medicare, and how insurance companies are also important to have the opportunity to provide insurance for each and every individual. This concludes my video. I appreciate you listening. Have a good day.